Hello and welcome everyone to Heart of the Matter, a broadcast series where survivors come on and share their stories, inspiring us to live the healthiest lives we can. I'm Susan Smith, your host. I want to remind everyone that heart disease is the #1 killer of women, taking the lives of 1 in 4. I give you this statistic because my guest today is a heart attack survivor. I'm so pleased that my heart sister and friend, Jody Knack, can be here with me today as my guest. She's going to be sharing her story and answering some questions for me. But before we begin, I want to introduce her to you. Jody has been married for 34 years. She has 3 daughters and 5 granddaughters. She's one of my fortunate friends who has 3 homes in which she lives during the year. She spends winter in Fort Myers, Florida, and the rest of the year between Aurora, Illinois, and Lake Geneva, Wisconsin. Her hobbies are walking, reading, bargain shopping, do-it-yourself home projects, decorating, and travel. Her passion for the last 17 years has been volunteering, spreading the word about women and heart disease with Women Heart as a champion, support group leader, and district leader for Illinois and Wisconsin. One of the big accomplishments that I know about Jody is that 3 years ago, she created a Facebook group for women heart patients called We Are Heart Sisters. This, above all things, is a great way to support other women on their journey with heart disease. I'm so pleased you're here. Won't everyone help me welcome Jody Knack? Hi, Jody.
Hi, Susan. Thanks for having me.
I'm so excited you're here, and I want to emphasize that Facebook group is, I refer people there all the time. It's such a great support group that's online for women who need support. I'm going to ask you some questions here in a minute, but I'd like to begin by having you tell us your heart story. Would you please begin?
Oh, sure. My story started in January 2000. I began feeling fatigued, extremely fatigued, out of the ordinary. I was having intermittent, like chest pressure between my breasts. I was feeling like a heaviness in my arms down to my elbows, both arms. I was having jaw pain in the right side of my jaw. So my first step was to go see my dentist and see what was wrong with my jaw. I thought maybe a TMJ or some other kind of problem, and he said everything checked out fine. So then my second step was to go see my father's cardiologist. And I went to see him, and he gave me a walking, not nuclear, walking stress test that I was able to walk for 11 minutes. He said that I checked out fine with an EKG in the stress test. And I asked him if my symptoms could in any way be heart related. And he advised me that I was 44 and that it had nothing to do with my heart. I kept having these intermittent feelings. And then I started beginning to feel that I wasn't swallowing my food. It was like getting stuck in my throat. So then I went in and I seen another cardiologist, a female cardiologist with these issues, and I was dismissed a second time. And I was referred to a gastro doctor because of me complaining about my throat issues and not feeling like I was swallowing correctly. And they said that they believed I had acid reflux. So gave me some medicine to start taking. And then I had an episode where all these symptoms just started coming more frequently. And I went in to an ER, and I was dismissed by another male cardiologist. I was having pains up in my shoulder blades. They said I probably pulled a muscle. All these things were not adding up, and I kept shaking my head and saying to my husband, I really feel that something is being missed, because I can't understand all these things I'm feeling, that it would just be acid reflux. And so I took the medicine that they gave me for a couple weeks and was having no real relief. And just like a gnawing feeling deep inside that they're missing something. Nobody's listening to what I'm saying. 3 cardiologists, a gastro doctor, a dentist. I mean, I just thought, who's going to listen to me? And so I left a job. I worked for the union, Carpenters Union, for years, and I was switching to go to another local union. And Monday was going to be my first day of work at the new job. And on Sunday, I had my youngest daughter's 12th birthday party planned with about 40 people. And I was feeling fatigued, something was off. But I went ahead, had her birthday party for the 40 people, cleaned up the party, went to bed, got up, went to my first day at the new job. I was being trained, and all these feelings, the jaw, the pressure, the throat, everything came back at once, but then I started profusely sweating. And the woman training me looked at me and asked me if she should call 911. And not to make a scene at a new workplace, I said, nope. Let me grab my purse and my coat, because it was February 21st. Let me grab my purse and coat. I need to leave. I was only there about 2.5 hours at the new job. Got in the car, drove 20 minutes. My husband had worked nights. Woke him up, said something's really wrong. By this time, I started getting nauseous, and everything was not easing up. All these things that I had felt for 6 weeks now were just staying. And so he called. The last doctor that I had seen was the gastro doctor. And the gastro doctor said to have me come into the ER, drive me in. So he did, got me into the ER. They worked me up. They said, now we think we know what's wrong with you. You have a gallbladder. You're having a full-blown gallbladder attack. We're going to give you a cocktail to drink that's going to calm down everything. And then we're going to take you for an ultrasound of your gallbladder. So they did this. I drank the magic potion. That didn't help. Got sick. They took me for the ultrasound, put me back in the stall. They came back in and they said, now we have the answer to what's been going on these 6 weeks. It's your gallbladder needs to be removed. It is full of stones and it is inflamed. So it was President's Day, Monday, February 21st. My husband called our kids at home, said they finally got an answer for Mom. It's her gallbladder needs to be removed. So the hospital gave me the choice of either staying in till the next morning for surgery, or I could go home and be brought back. So I said to my husband, don't let me leave here. I need to stay in the walls of the hospital. So the protocol was to do an EKG and a chest x-ray to send me upstairs to a bed. Now, mind you, I had been there a grand total of 6 hours from this time to chest x-ray and EKG. They had, I guess, to find out later, they had ordered a stat EKG that never got performed because I showed up during shift change.
Oh, no.
So they did the chest x-ray, portable chest x-ray. The fella came in to do the EKG. He left abruptly.
Bad.
One tape came out, he tore it off. Second tape came through, he exited, and I heard his same voice calling for people. And within minutes, the room, I was surrounded by a team that told me to stay calm. We have missed every symptom here. You're in the midst of an acute MI. Remain calm. We're going to administer TPA to try to bust the clot. They did that. That did not work. They gave me a second dose of TPA. That did not work. They pulled my husband outside the curtain. A couple nurses stayed in the room with me, and I could hear the doctor talking to Steve that we need to get her to the trauma center because this hospital does not have a cath lab.
Oh my gosh.
So we can't even do an angiogram to see how occluded she actually is. They said she's not stable to transfer, but we have no option. We can't leave her here. And I was like, I remember I could hear what they were saying, and I thought, I cannot believe that this discussion is about me.
Yeah.
And then they transferred me via ambulance, and I said, where are you taking me? And they told me the trauma center. And I just kept saying the whole way in the ride in the ambulance, please don't let me die. I have 3 daughters and a husband. They'd say, okay, Jody, we're doing the best we can. I said, but please don't let me die. I have 3 daughters and a husband. And they said I repeated that the whole 15-minute ride. And then when I don't even remember like getting to the ambulance bay of the hospital, all I remember is the running feeling down the hall. It was something like out of TV.
Right.
And I had oxygen on my face, and I pulled the oxygen away because I seen my husband and his youngest brother standing at a doorway, and they whisked me past Steve and Ken, and I pulled my mask off. That's my husband. And they just whisked me right past him. Went into the cath lab. I was 98% occluded in my LAD. They gave me, I was grateful to have been able to get 1 stint to open up the artery. But due to the fact that it was so many hours that they feel like the heart attack had been having a grip on me, that they overlooked that time is muscle.
Yeah.
And I have irreparable heart damage. I was left with an EF of 23.
So Jody, I have chills all over. I mean, just hearing this story, it's so frightening to hear, and then to know you went for 6 weeks. And so you finally got the stent. They opened up your artery.
Yes.
And so I need to ask you some questions, but I'm still here in disbelief. My next question, I'm sure you're going to say, but what were the emotions you were feeling after you got that diagnosis, after you had a chance to gather your thoughts? Did you have emotions?
You know, I just wanted I had this fear that I wasn't going to live.
Yeah.
You know, my
That's good.
husband was angry. I had this fear
Yeah.
that, um, and I was the anger I had was that nobody listened.
Yeah. And I think that's the lesson we're going to learn here from this interview is that no one listened. I mean, how many doctors? It was just, I was counting them. I think you had 5 or 6.
Yeah,
But
three cardiologists, a gastroenterologist, and a dentist.
so your fear is quite normal, and I always talk about emotions afterwards because I want women to know that the emotions we feel afterwards are totally normal and perfectly okay to have because you have to work through them. Did you have to make some lifestyle changes after this?
Well, I was a 28-year smoker,
Oh,
and I smoked my last cigarette in the car on the way when my husband drove me to the hospital.
okay.
I believe in the 15-minute ride from our house, I had 2.
Okay.
And of course, the very next day, when you have 3 cardiologists or fellows or cardiologist and his staff come in at the foot of your bed, and their words to me, the main cardiologist said, you really scared us. He said, am I correct that you just started a job yesterday? I said, yeah. He said, and you're 44? I said, yeah, I'm 44. And he said, you're feisty because even in the cath lab, you would not stop repeating, please don't let me die. I have 3 daughters and a husband. He said, we almost were laughing because you just kept repeating it. And he said, but I have to tell you, you smelled like an ashtray. We know you were a smoker just by how you smelled upon our taking care of you. And he said, and I'm going to tell you that if you'd like to see your 45th birthday, you will give up your cigarette habit. So I did. 8 days in the hospital really gets you past the worst
That's true.
of
It would.
the nicotine.
I can imagine. Okay. Wow. So last question. As this heart attack survivor and a survivor of being dismissed, what is your advice to women about heart disease? What's one thing you would tell us all?
Well, like I've told many women, you need to make sure they listen. You have to be heard because my belief is if they truly listened, you most often diagnose yourself. If they really took time to hear what you had to say. And I said, and if they don't, raise your voice a little louder. If you don't think they heard you, because if you don't get the word out, and you really need to get that word, and the nurse should be on board that sees you during an appointment. She's your first point of contact.
That's right.
And she should also be listening for her notes or whatever. And then the doctor needs to sit and listen.
Right.
Listen.
You're so right. You're so right, Jody. And my goodness, thank you so much for sharing that story with us and for your insight and for your advice. I have goosebumps after just listening to you. I tell you, I'm really grateful. I am inspired. I think our audience will be inspired. So I'm going to sign off for now. I'll be saying goodbye to the audience, but Jody, stay right there and I'll talk to you when we're done. And for those watching, thank you for coming on today and we'll see you next time. Bye-bye.
Thank you. Thank you.